this is Dallas and Josie, two of your friendly therapists. We just want to give some help and hopefully some helpful advice as far as some things you can do to help prevent back pain. Some of these exercises we oftentimes show patients as well to treat some of the back pain. So we'll show you just some basic things. One thing that I tell everybody though, when it comes to back pain, you want to stay active, you want to stay moving. One thing I tell a lot of people is motion is lotion. And so one thing that you'll see that's one of the best things to do is to just stay active, like I say, is to walk. Walk regularly. If you walk a lot, that gets nice good motion, it gets blood flowing not only to your legs but also to your back. The more blood flow, the better, the happier your back will be. Okay, so one of the first things that you want to do is you want to make sure that you have good flexibility in your hamstrings. If you have tight hamstrings, that will predispose you or increase your chance of developing back pain. So one of the major muscle groups to stretch is your hamstring. When you stretch your hamstring, you want to keep your back straight as much as you can. A lot of times people will stretch their hamstrings by bending over. That's not always recommended because when you flex your back, that can actually cause other problems with your back, especially if you have any disc-related problems. Then flexing and bending at the back, can actually increase your chance for back pain. So a good way to stretch, Josie's going to show you here, is to lay on your back, and you can grab the back of your thigh, and then if you'll kick your leg up until you feel a stretch. You feel a stretch, Josie?
Yes.
Josie's stretching. Okay, so pull that leg, kick up to the point where you start to feel a stretch at the back of your hamstring. Long stretches are better. If you'll hold the stretch for at least 20 seconds, 20 on up to 30 seconds. Usually have people do, 5 stretches. And so after 20, 30 seconds, let it down, let it rest, and then you can repeat the stretch. This is probably my preferred method of hamstring stretching. I love this stretch because it keeps your back straight and it also helps you to relax a little bit. That's the other thing about stretching is you want to stretch, it should be a comfortable, gentle stretch. You don't want to force anything. It shouldn't be painful while you're stretching. You just stretch to where you have some discomfort, not pain. So this stretch, you can keep the back straight. You bring your leg up along, a doorway works really good, so you can put one leg through and then put your leg up onto the door jamb. Now Josie actually has pretty good flexibility. She can feel it stretching. A lot of people are not going to be able to get the leg this high. So you adjust it just by your body position. The more Josie backs up, the lower the angle, and the easier the stretch is going to be. Another good stretch is a prone extension stretch. But I'll also say that some of these exercises, you need to consult your physical therapist and see if it's appropriate for you. If you have back pain, and especially if your back pain is from arthritis, then this stretch may not help you. But again, this is helpful to prevent back pain. You want to maintain extension. That especially helps if anybody has discogenic back pain, any problems with a bulging disc or herniated disc. This can really be helpful. But you first start, and again, you always kind of want to work into your tolerance. So sometimes people just start flat, laying on their stomach. And then with this exercise, the easiest way to work into it is to first come up on your elbows. And as you come up on your elbows, you can see that Josie has some extension right here. And that's going to help accentuate that lordosis, that inward curve of her low back, which is important to maintain. A lot of times we spend our lives sitting in chairs. A lot of times our back rounds all the time, that we don't spend the necessary time that we should in extension. And so this is a good stretch to do. To advance from here, Josie can then go up on her hands, and then she gets even more extension. And you just adjust this to the point where you feel a comfortable stretch that you can relax with. If you need more, you can slide your hands closer. And this stretch, you don't need to hold as long. I usually have people hold, for about, 3 to 5 seconds, and then to come back down, relax a little bit, and then come back up, and just repeat that 10 times. Okay, so the next exercise, it's also very important to maintain your strength. Two of my favorite exercises that exercise your trunk and exercise your core appropriately, without putting excessive stress, are plank exercises. I really don't like sit-ups. I don't even really like crunches that much. That can put increased pressure on the discs in your back. But planks will strengthen your core appropriately without putting excessive stress on your back and on your disc. So to plank, the easiest one is to first just kind of go up on your elbows and your knees and just kind of plank and hold. And while you do this, I tell people, everybody that had an older brother knows what I'm talking about. But if you had an older brother and he'd always punch you in the gut, you'd say tighten your stomach, before you get punched in the gut. And so that's what you kind of want to think of. When you're doing this, you want to tighten these core muscles. You want to tighten and you kind of want to bridge right here. Kind of raise those hips and tighten those core muscles. And so Josie's awesome because she had a baby a little while ago, and she's doing the exercise perfectly. So, all right. Okay, so then to advance the exercise, go on your toes. Again, your focus is right here on your core, contracting those muscles like somebody's going to punch you in the stomach. Even more advanced is to hold here and then kick a leg up and down. Whole time you're balancing and stabilizing that core. All right, the last exercise that I'll show you is another plank, but it's a side plank. And I feel like this one helps your back probably even more than the prone plank. It's a good way to even test for back pain. You should have symmetrical strength. You'll find oftentimes though that one side is a little weaker, or that one side's a little easier to do than the others. That can predispose you for back pain. You should have equal or pretty symmetrical strength when you do this exercise on both sides. Again, you're going to plank and you're going to come up, and this time your focus is still on your core, but it's like you crunch your obliques on the side and you try and bridge up and stabilize and hold. The beginning level is to just kind of go on one knee. To progress from there, you then go up on both feet and plank and hold. And now we're really going to test Josie. The advanced is to then plank and hold while you kick your leg up and down. And that's hard. Good job, Josie.
Thanks.